Good afternoon, everyone. I'm going to demonstrate how to do the CAM-ICU in less than 2 minutes. Before you start the CAM-ICU, you must assess the RASS score of your patient. If the RASS is -2 or above, then the patient is eligible to have a CAM assessment. If the RASS score is -3 and below, it means that they're deeply sedated, then you need to wait until they're in a lighter sedation level to do the CAM assessment. For the purpose of this demonstration, we're going to assume that Mary, who is our model today, have a RASS of -1. Before I start any testing the CAM-ICU, I just wanted to show you that there are two core elements that must be present for a patient to be delirious. One is feature 1, which is a fluctuating mental state, and that's defined by a wandering RASS score. So that's a RASS score that goes above and below the baseline in the previous hours or 24 hours. So that's the feature 1. The next one is the feature 2, which is the inattention. Patients who are attentive cannot be delirious, full stop. So a patient to be delirious must be inattentive. So this is the most important fundamental test that we do on patients' assessment of their delirium. So I'm going to demonstrate to you how we do the inattention test using the Save a Heart technique. So I usually start by teaching Mary how to squeeze my hands to the letter A. Mary, hello?
Hi.
Mary, squeeze my arm, please. So now this is the direct order. Relax, please. Mary, please squeeze my arm to the letter A. A. So now I have taught Mary to squeeze my hand if I say the letter A. Now I need to say the letter A within the Save a Heart phrase. So Mary, I'm going to say a few letters now. I want you to only squeeze to the letter A. I'm going to start now. S, A, V, E, A, H, A, R, and T. So Mary was able to squeeze correctly to every A and not squeeze to any other letters other than A. Delirious patients usually squeeze to every letter or do not squeeze at all. 2 mistakes are allowed for the inattention to be negative. So that's the inattention. So if the patient is inattentive and have a fluctuating mental state, then you look at their baseline RASS. If their baseline RASS is other than 0, so if their RASS is -1 or -2 or +1, then you don't need to do anything else. That's enough to give them a delirious or not delirious status. Fortunately, that's the case in 90% of our patients. However, if the patient has a RASS of 0, then they are calm and cooperative and able to communicate adequately, then we would be able to test their disorganized thinking, which is the additional feature that we would need to have in addition to inattention and altered mental state to qualify for a positive delirium. And then we ask them those 4 questions that are in your app folder. These questions are simply asked to the patient to nod the patient yes or no, and they will answer them yes or no, which are pretty simple to do in somebody who is a RASS of 0. Thank you.